okay, juniors. Western Vet Clinic is right outside of town. Most of you know where it is. And they are a long-time RTR yearbook sponsor. So I started with our yearbook sponsors when I thought of who we could talk to. And I had also had a conversation with Lauren at some point. When I contacted them this fall, Roxanne was my point of contact, and I got a couple emails from Lauren too at some point.
Oh, okay.
So I wasn't quite sure who was going to show up today. And we were discussing how, okay, we were discussing some of the career opportunities within veterinary science. And that a lot of people think of veterinarians right away, but there's some other things as well. There's vet techs, there's groomers, and Roxanne is gonna maybe brush on a couple of those things as well. Well, we're already started. And you are one of 3 veterinarians.
Currently we have 3, correct.
So, she's going to tell you about her career journey, how she got to be a veterinarian, things she learned along the way, what it's like to work in this field, this career field. And then I believe she's planning on opening it up for questions. Let's see. So show her your interest, okay?
I'm not going to see that either. So.
That's fine, you don't have to.
Filming.
Whatever you're comfortable with.
So.
Take it away.
So as she said, Dr. Roxanne Nielsen, a lot of times go by Dr. Roxanne. We tend to keep things a little informal at our practice, unlike some veterinary clinics where it's strictly first name, doctor, last name. I feel like it's a little more personal touch at times too. But I have wanted to be a vet since I was in the 3rd grade. And unlike most people, I never did change my preference of all through college. They always say you'll change your career path 3 to 5 times. This is just what I knew I wanted to do. And so I started out at Moorhead State. Pre-vet is either a 3-year or a 4-year undergrad degree. You do not necessarily need an undergrad degree. I did get a biology degree and a chem minor with an animal science minor because I went to try college at my schools. I was up at Moorhead State and NDSU. So I was College of Ag at NDSU, so I got my animal science credits in at NDSU. And went on to vet school at the University of Minnesota. In between there I went and got a master's in ruminant nutrition as well. So I also have a master's degree. I just kind of want to know what you guys want to know about vet med, really. You know, I like it because we have a lot of diversity in what we see every day and what we do every day. There's no routine spay, there's no routine castration. I mean, everything is, even though you take a routine item, there's something different about it every time, and that's what I like. It's just a little bit of a challenge every day with something new. You had some other questions that you had on here. First one was most valuable thing I learned in high school or college probably was taking your speech class. I know everybody hates speech class because you have to get up and speak in front of people. But really, that is probably one of the most important classes that you'll have, that along with a business class. Because in veterinary medicine, through vet school and undergrads, you don't get any business classes. And if you're going to become an owner someday, that is something that they don't teach you. And so that would be a secondary class that I think would be very important to take, would be a business class of some sort as well. Whether you have it in egg business or just general business, those are some important things. My first job was actually working for my dad at the Dairy Queen. And so we always joked that he produced used the milk that I would produce, because my second job I acquired by putting an ad in the newspaper. I did not tell my dad, and he came and told me, "So I see you're leaving me," because I got a job working on a dairy farm that way. And so I was kind of afraid to tell my dad I was good looking for another job, I guess. But that, in this business, especially if you're doing large animal, if you would like to work with either large or small animals, getting any kind of experience you can with animals is very important to help you to get in. So I did not grow up on a dairy farm, a farm at all. We lived out in the country. I had a horse when I was a junior in high school. I think I acquired a horse, dogs, cats, that kind of thing. But if you're gonna be working with large animal, they really like to see you putting yourself out there and working with large animals so that they know when they come to interview you for vet school that this is something you will really want to do, that you've had the experience in the background to know that this is really what you like to do. Because a lot of people think that I want to work with horses because I love horses. It doesn't work that way, because just because you love working with horses doesn't mean that you are qualified to doctor horses. That is another thing that people always say, I'll get into veterinary medicine so I don't have to speak to people, because I don't like people. That is wrong, because this is a very people person occupation as well, because you still have to talk to the owners to say what's going on with your pet and what's wrong with the animal. The animals don't speak in a matter of speaking. They can kind of communicate. They have ways of communicating. A kick and a bite are pretty strong communications, but they don't talk. And so you still have to be able to communicate to the owner so that the owner understands what to follow up with for treatment as well. So that, I guess, is one misnomenclature, I guess, for this practice, is that it's not a people practice. It very much is so. Oh, what do we have here? How many hours do we work a week? Yeah, this job is not a set hours. If you're a vet tech or a groomer or any other part of the industry, office managers, they will have set hours. This, as you all know, we're on call 24/7. At least in our practice, if we're not, if you're in a bigger city, you will have an emergency clinic that will be on call 24/7. So that just like your regular hospitals, that if your pet needs help, somebody's usually there to help them then. And so usually what I would put in would be, I would say anywhere between 40 and 65 hours a week would be a pretty good average. Kind of depends on what the season of the year is and how busy we are with either shoot work or horse work, or I guess cats and dogs can keep you up late at night as well when you got a dog whelping or having babies. You know, they'll call it any hour of the night too. Mother Nature calls, it doesn't say what time it is. So. A couple other things you have is do we have travel in our career? I think that would depend a little bit on what type of veterinarian you would want to be. So we have general practice, which is what we are. So we do basically everything. But you can also be specialized in equine. You can specialize in small animal. There are government veterinarians who will have a lot more travel, and you're probably not going to see as much hands-on. So if you like more of the, how do I want to say this, the control of working with zoonotic diseases, control working with food inspection, that's where the government inspectors would come in. So all of your food, I know one of the questions was, how do we impact society? This job is very fulfilling in that respect, that we help not only keep your pets safe, but we also help to keep people safe too, because as you know, there are many diseases that are called zoonotic, that if your dog gets rabies, you can get rabies. That's zoonotic. If your dog gets some parasites, you can get some of the parasites from your dog. And so we try to help communicate and instruct owners on what some of those communicable diseases are and try to prevent you from getting those as well. We are also involved with agriculture in, as I said, food inspection is one big area that we help to also help society. We're keeping your food safe, and I think that's a very important role for veterinarians, is that we keep the food chain a safe supply of food for us as well. If you guys have questions and you want to just butt in anytime, you know, if you're thinking of anything, just raise your hand and I'll answer questions as we go here too. If you have something specific you want to know about my job or what we do, go ahead.
You ever gotten bitten?
Have I ever gotten bit? What do you think?
Yeah.
Yes. Have I ever needed stitches from a bite? No. My finger is crooked from hitting a cow's head. A cow's head actually hit the corner of a building. So I came back and it's a cement wall, and I hit that and I cut it down, cut my tendon on the end, so I no longer have a straight finger. Unfortunately, that was about the 5th cow into about 100 I had to prick check that day. I went to the parlor, wrapped it up, and then gloved it up and kept going because I had nobody else to go. So yeah, there's sometimes, I have the scars on my forehead, yes. I've had shoot work, and that was, I had about 4 bowls left. The shoe came down and hit me on the forehead. So yeah, I wrapped my forehead up and kept going until somebody could come and get me because they don't want me driving for some reason. But yeah, so yeah. Yeah. I've had my techs get bit as well. Anytime a dog wakes up from anesthesia, they aren't necessarily aware of their surroundings and really what's going on, and they'll see something going by, and they a lot of times will just go like this, just catching, whatever, not necessarily even thinking they're grabbing you or biting, and they can still bite pretty hard with that. I've been very fortunate that I've never been seriously injured working with horses, but I would say your liability insurance for equine practice is about 10 times as a small animal practitioner, because the risks are just a lot higher working with horses than working with cats and dogs usually. Usually with cats and dogs we have pretty good techs that are able to help hold and restrain animals as well. So they sometimes get more of the brunt of it before I do, because they take it as their role to protect the doctor, as do my large animal assistants. But
So
yeah, good question.
So with small animals like cats and dogs, a lot of people have those.
Mm-hmm.
So are there basic things that somebody could do to calm their animal so they're less likely to get bitten? Have you stumbled across any techniques like that?
So that is kind of one of the hot CE topics right now, is how to be a practice that is very welcoming and calming to animals when they come in as well. If you have to, pre-training is obviously important. So like the puppy training can help socialization skills. But if they're a breed and they're already an older dog that have already been out, we'll use skills such that, okay, if they're just nervous about sitting in there, they go from the door right to the room and right away get looked at, so they don't have time to sit and think about being nervous and where they're at. If they're already aware of that, we'll take and maybe go to a different room and change up their environment a little bit as well, so that they don't have that phobia about that's where I got hurt last time, I'm not going back in that room. Cats especially are very cooperative, with pheromone treatment. So we have several different pheromone options, and so different sprays. There's, as you plug in your wall for your room deodorizers, air scents, that kind of thing.
Do you guys know what pheromones are?
So pheromone is something that, so if everybody knows, pheromone just kind of helps to calm them. It's a scent that only they can smell, but yet helps to keep them calm. So those are a couple of different options. Buddy blankets, wrapping them up into a tight, just snug wraps can help as well. Yep.
Thanks.
Fear-free practice, it's called. So that's a lot of CE that we have right now is focusing on that.
What's the most exotic animal you've ever treated?
We've had, what did we have? Iguanas come in, chinchillas.
Wait, a what?
Chinchilla, kind of like a gerbil, only longer haired, small little rat type thing, kind of thing.
Just
Kind of
Kind
cute.
of like you do.
Kind of cuter than a gerbil.
That's really
Chinchillas, we've had a few birds come in as well. Never any snakes, thank goodness, I don't really care for that. I don't mind worms and gory, gooey stuff, but if you bring something in that's got a bunch of maggots on it, I'm gonna crawl, because I don't like maggots, so that's my fear. If you talk, what's your biggest fear of practice? Maggots, little teeny tiny worms. It's like, they just gross me out. I can handle a lot of pus and smells and poop and everything else, and you bring maggots in and I'm like, ugh. That's just me. Any other questions? Yeah.
What's like the worst behaved dog has ever, like an animal has ever been there, like had really bad problems with a dog before?
Ones that you just cannot work with. I mean, I literally have one dog that comes in. The owner drives it in the car, pulls it to the other side, and you have to sedate it immediately because the owner cannot get close to the animal. So instead of fear-free, he's beyond. He just never, even at home, he is this way with anybody coming into the house. So it's not just at the clinic. And so, yeah, we have to sedate him in order to work with him.
What kind of dog is it?
It's a large breed dog.
She can't tell you.
Oh, I suppose.
Privacy.
It's a large breed dog, but it's one that has known, there are certain breeds that are known to be aggressive. Pit bulls get the baddest rap. They are some of the most lovable sweet dogs. I had one in just the other day that was kind of growled at my partner, and you go in because you've worked with it before, and I go, yeah, she gave me 2 little growls, and then she's eating treats out of my hand and rubbing up against me, So it's, again, back to what is their experience. Some of them are actually just don't like men. And so if we know that this dog doesn't like men, for whatever reason, if they've had a bad experience, UPS man or whatever kicked him in the butt because they tried, thought they were coming after him, so now I don't like men.
Yep.
So we just keep it that one of the 2 women vets will go in and usually work with that animal.
My dog is that way.
Yeah.
Yep.
And it's very common to be that way. Cats, they just get blankets put around them usually and tacoed. It'll be a taco Tuesday. We taco them up and then they're fine. Yep. Get the spray out and put the spray by them. Yep. So, do you have something else? Otherwise I'll continue with your questions for on here.
Oh, they'll come
You
up
think
with
of
more as you
something?
go.
Yeah.
Have you ever dealt with a patient that was just obnoxious and rude?
Patient
Human?
as in human or
Yes,
patient as in the animal?
a human.
Very definitely. So one of the questions in here, I noticed is at the end, how do you deal with rude or upset customers?
Yeah.
That could be, and that is where you get out your communication skills and keep your calm. And, they teach you that the customer is always right, and so you try to see their point of view, acknowledge their point of view, and try to re-explain your side as well. We'll do what we can to compensate you or make things better. We'll do what we can to make things right, if we can. And just it's very much about not getting your voice up as well, and keeping very calm to talk to them. Because yeah, you definitely will have people, it happens a lot, whether they have an issue with the treatment they received or the price of, some of the antibiotics we use these days are pretty expensive. And if there's a problem with, I didn't think it was gonna cost that much to treat my animal, it's like, yes, but your animals will live with this drug versus using a different drug that may be a lot cheaper. But if you lose an animal, now you've just used all your drug costs, to justify using the more expensive one as well. So you just do your best basically to stay calm and listen to them as well. I think that goes a little bit with how we practice as well, not just at our practice, I think in general. One question here is, how does honesty impact your work environment? We're not going to do shortcuts. A lot of times we'll get people that'll say, oh, well, so-and-so will give me medications. It's like, yes, but I have not seen your pet, so I cannot give you that medication. So that's the veterinary client-patient relationship, it's called. I have to know you and your patient, your pet, in order to give you any drugs or anything. And so in order to do that, and I've had several people get very upset with me because I just won't dispense an antibiotic to them. Well, this again is back to protecting the society, because if we overuse antibiotics, this is a very hot topic in the large animal realm of veterinary science right now as well, is overuse of antibiotics. And I don't know if you know anything about veterinary feed directives. So people used to be able to buy antibiotics to put in their feed to help control and or treat, 2 different terminologies there, respiratory diseases in their cattle that came in, say. So now, in order to get this antibiotic, they have to have an association with a veterinarian to be able to put that antibiotic in their feed so that this does not get overused and that the bacteria that then don't become susceptible to this antibiotic, because a lot of these antibiotics are also used in humans. And so that is, probably in the last 2 years, that is something new. As far as for what will come up in the next 10 years, I think I see a little more restrictions on that, even more coming. And so,
So with that, it's basically the ethical treatment, right? So how do you see ethics both in your use of prescribing stuff and of working with animals in your practice?
well, just as I said, I'm not gonna just give you antibiotics just because you know your cattle are sick and you've used this antibiotic previously. Or if I have never, okay, so I see other pets that you own. I haven't seen this pet. I don't know what's going on with this pet, and so that's something that we're really kind of cracking down on more so, especially in the pet world because of amoxicillin. Every kid in here, I'm sure, has had amoxicillin. That is a very common first line of antibiotics that we use for cats and dogs. And so if I just haphazardly give you antibiotics for your cat because you think it has a bladder infection, without checking the urine, without looking at it, then the bacteria that won't become susceptible to using amoxicillin, and then babies won't be able to use it when they get sick.
So is there, in the veterinary world, is there a governing body that checks?
Yes, the Food and Drug Administrators, FDA. There's FDA and USDA, Department of Ag, both kind of govern what we can do and what we sell as well, and inspect us basically as well. We have Board of Animal Health we work with as well that is in charge of our licensure, and so if we are being unethical in how we dispense drugs and use antibiotics or treat animals, doing surgeries without anesthesia, the board, which one am I saying here now? I'm like me confused here. The Board of Animal Health is the one that will come down on me then and take my license away basically. So yeah, I'm going to be very protective about what I'm signing my name to. We do a lot of health certificates for animals so that they can cross borders and go into other states. That just says that when they left here, they were healthy and they aren't taking it to another place. There's interstate and intrastate, interstate health certificates both. And then when you get into going across seas, like some semen companies will ship semen overseas, and then you have the whole USD in there too. Mm-hmm.
So some animals have allergies. How do you deal with that if you don't know that an animal is allergic to something and you give it to them?
Good question. Allergies are very common in pets, in dogs and cats as well. There is allergy testing that you can do. Some put a little more faith in it than others as far as for the reliability of it, because the only gold standard is the intradermal skin testing as they do in humans. So humans, you have an intradermal skin test to test for allergies. You can do that on dogs as well. It's just not done very often. When they came up with this blood test for it, because the blood test they feel picks up a good percentage of what they are or could be allergic to. And then it's just a matter of avoiding those allergens. That's not always possible. And so they do also make allergy shots for dogs too. So if your dog has allergies, just like a human would get allergy shots, your dog can get allergy shots to help desensitize them to whatever they are allergic to. Food allergies is probably your most common allergic reaction, and second would probably be flea allergy, dermatitis. So just controlling fleas. Mm-hmm. Good questions? Anything else? Okay. When I started my career, how important did you think communication skills would be as I get tongue-tied? I think I always knew that it was important. I guess I wasn't surprised by that one. I kind of knew that. And having gone through the master's, in your master's you have to do an oral thesis as well. So that means that you get in front of your panel of supporters that say whether or not you can get your master's, and you have to present, and you also have to present at national meetings, which is in front of at least 500 people. and I didn't really ever have any problem doing that, so that was pretty easy for me. I know it's not always easy for everybody else. How do you communicate different with various groups or various purposes? That one is a very important question, because if I'm talking with fellow veterinarians, I'm going to be able to use some of my more technical terms. When I'm talking with most clients, they don't understand flea allergy dermatitis and what dermatitis even means. And so I want to say we dumb it down, but I don't want to insult everybody that's here either, but really, it's very much talking in plain language. Your animal is allergic, and so he's getting these bumps from the fleas. And the bumps are usually have bugs in them that cause bacteria and this irritation and this redness that you're seeing on the skin. So versus using the big words, I am guilty of that sometimes. So what does that mean? And so we do that. My techs are also very good. This is a very important job for your technicians as well, because they don't want to ask the doctor because they don't want to look stupid in front of the doctor. So when the doctor leaves or before the doctor comes in, we have the techs go in and they talk to the techs. And then when the techs are checking the people out, they'll go over things again, just make sure you do this, this, and this, review, 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 hear it 3 times, and then you maybe will remember it. And we still write it down so you can take it home and look at it when you get home. And then if you have more questions, call me back. And so when we try to, especially if it's a very complicated condition or you've got multiple conditions going on, it can be very confusing. And so that is one thing that we will do, is give them different people to talk to, different forms, visuals, handwritten instructions, just to help identify and remember what they need to do.
So how much of talking to your clients' owners, the human component of it, how much of that is teaching people how to work with their pet or how to treat their pet?
A lot of it, because even when it's something as simple as what I think is really simple to deworm your pet, you just lift your head up and go like this. I go through every time and I explain when you're giving your pets this amoxicillin drops that I've now sent home because they have a bladder infection, how to do that. Put your hands here on the nose, lift the head up to the sky so they open their mouth naturally and you're not trying to pry their mouth open. And so it's very much trying to explain this or apply it with gloves or how many times a day. Sometimes if you make yourself a calendar, checklist, so that you can remember when to do it, because I am very bad about remembering how long and how many times to treat my own pets. And I will admit that as well. It's client compliance can be a very difficult part of our treatment because you know that you have a hard enough time remembering to take your own pills, and now I got to remember to give it to my dog too. And so that is just something that you do your best with to communicate how important it is. Some drugs are more important than others. If you miss a pill or not, steroids are one of those that you need to make sure that you follow the directions very carefully, and I will emphasize that over and over. Because if you stop suddenly, it can crash. Your pet will die. I mean, it can be very serious. And so some drugs I get a little bit more information when we talk about that.
So if you have someone come in and you have to teach them something like this, who would your ideal client be? Like, what would they act like? What would they do to kind of help you treat their animal? Does that make sense?
I'm not sure.
How would they communicate with you to make sure that they understood everything? What would you like
Sometimes
them to
I'll have
do?
them repeat it, or I'll have them do it in front of me, especially if I'm giving insulin shots. So that we have diabetic dogs and cats, both. So if you have a dog that comes diabetic, you have to give the shots. I'm not going to be there to give it. This is a shot. It's not just a pill. It's not just an oral liquid to give. And so then you have to become comfortable with how to give shots. And so I'll show you how to do it first, and then I may do it a fake showing, a fake giving, and then I may have you actually do it then in front of me as well, just so that I know, especially with that one, that you know how to do it. A lot of the times by the time I show them how to give an oral medication, I have to give it and it's done, and I know or even eye meds too, it can be very difficult, so I'll send them in their lap, say you have to hold it like this, and put it set up, or get somebody else to help you to administer it as well, because a lot of my patients are older. And so I know they are not gonna be able to handle this cat or dog by themselves, and I say, you know, find somebody who can help you maybe hold while you give it, or vice versa, to assist you with that. Yeah.
How long have you been doing this?
How long have I been a vet? Oh, now you're gonna age me. I graduated in '95, so 22 years, almost 23 years now. Yeah, yep, time flies though. I know that is one of the biggest things about when you go to vet school, that it's 8 years. I can't handle another 8 years of school, especially at your stage when you're, you know, almost seniors here at seniors. Really, it goes so fast, those, you know, 7 or 8 years of school. And then, like I said, I don't know where the last 20 years went, because that is one thing I would say about your job and your work you do. I'll get you in a second. Do what you love, because if you don't love it, it's a job. It's work. That is probably if you take anything away from today, remember that. Always do what you love and have fun doing it, because if you're not having fun, we have fun every day at the clinic, making jokes and, you know, I don't want to get into too many gross things, because a lot of part of my job is kind of gross, but I love it. So that is one important thing, and that's why I like it, is because we do have a lot of fun, and it is different things every day. And like I said, even though it can be the same procedure, there can be enough differences. I know I always tell clients too that if I say, oh cool, it's probably not good for you, because that means I haven't seen it before, which makes it fun for me. But I've done that to clients before too, or I knew that was what it was, and you know, I got one of my husband on one at that time.
What happens if you guys like run out of medication or something like that, and you aren't able to administer it?
So there are drug shortages. We do get drugs that put on back order that we are not going to be able to get. You have to. Some drugs are easy because, you know, you can use a different antibiotic, or there's generics that you can use that you maybe don't prefer to use as well. So you have to look for other things as well. Fortunately, we don't run into that very often, where we actually run out of anything, or if we do in the clinic, it's because of stocking issues. You know, when we talk about some of the business questions that are on here, and as we get back to the business class, you know, we're just taught how to use the drugs, how much to use the drugs, what route to give it, which one's the best one to use, not how much to keep in my store. They don't teach that. Inventory control. And you know, when you're talking in business applications, so business application in this type of business, inventory control can be a big expense on your part, because I have all this inventory sitting here, and then you're not getting any money paid back for it at the end of the year. And so you're just carrying over, so you have your funds tied up. So just a little bit different than having funds tied up in cattle. You know, it's a different type of in cattle. You're going to get the inventory, so of course we are too. But so that is something why sometimes you may run out of some things, or you may have a run on things. We had one weekend where we had 3 groups of sick cattle. Oh, my Zactran was gone off the shelf because of the number of head that we had to use. Then we just again had to choose another drug. Marketing is another one, and I know you guys do a lot of, do you do marketing in this class?
We do a little bit.
That?
We've been discussing it a little bit.
So that's another thing that in vet school and even undergrad you do not get taught a lot about, is marketing and how to market yourself. So veterinarians are notoriously horrible at promoting themselves and their business, and so that is something that
you're here today.
But we're here today. But we're working on. We have a web page even now, so we're getting up with the times. Yeah, you know, I learned on typewriters, handwritten typewriter. I didn't get a computer to learn, you know, and so it's just some of these typing skills and computer skills, social media skills. You guys are going to be at a great advantage to that over me, and how to market yourself by just using social media. I mean, here not too long ago, our idea of marketing was we advertised in the Yellow Pages. You could find us. Who uses the Yellow Pages anymore? You know, so I like that example. You know, it's very important to be on social media, but you also have to be careful, as I'm sure you guys all know with over your own personal accounts. You have to be careful about what's out there, what goes out there, and what people respond back, because you can get bad reviews on social media if you have too many of those as well. And so in this business, we practice medicine and science, but yet it's probably good to have somebody on board that also knows marketing and bookkeeping, and just putting your clinic out there and keeping your social media sites safe as well. You have a question?
Yeah, has there ever been like a case or an animal that comes in where you just can't figure out what's wrong with it?
Yeah, that's why it's nice to have colleagues and universities. The universities always will talk to you and say, what do you know, we can go over the case with them a little bit and they can give us our ideas, or we can do referrals. So if we're not equipped, we don't have an endoscope. I don't know how many cases I've had to refer because I believe they needed an endoscopic exam to fully diagnose what was going on. So that's a little bit, again, back to, you know, the marketing and size of the practice, rural versus a city practice, where they're gonna have a larger clientele of small animals to make it more affordable to have that type of equipment. You know, I have an ultrasound, I can do a lot with that, but it's not that top quality ultrasound that a strictly small animal clinic may have. So there's different types of equipment that you can have in there as well. We can get the information we need, but if we get any more in depth than that, then I may need to refer just to get an ultrasound, because that's the best way to diagnose, or to the University of Minnesota for an MRI. But they do a lot of MRIs and CTs on animals now too. Not a lot of my clients are willing to do that because of the expense, but it's available now. Whereas when I graduated, I don't think it was even available in small animals at that point. So yeah, a lot still is changing.
Does your job really affect time at home, like interfere with like family time and stuff like
Yeah,
that?
you know, and especially, it's becoming a predominantly women-based field. So 50 years ago, it was 90% men, maybe 10% women. Right now, it's probably 70 to 80% women and 20% men that go into this field. And the women are the one that have the children and are usually taking care of children. So maternity leave and maternity, being pregnant while you are practicing. I was very fortunate in that I had 2 children of my own. I did not have any complications through my pregnancy, so I was able to work right up to the day I delivered, basically. In fact, my calls I palpated, was it 30 or 40 mares the day before I had Johanna, and I had a difficult DA and milk fever. So DA is a displaced stomach, so their stomach flips over to the other side, you gotta pull it to this side. And then after that, I had to squat down and do a milk fever on a cow that was down. So I went into labor that day, you know, but I was very fortunate. But see, those are the things that as women in this field, you have to think about and you have to be careful about, because there are a lot of the drugs that we use as well that can affect women more than men. Lutolice is one. Lutolice causes abortions. Lutolice causes bronchial spasms, so if you have asthma, don't put out a syringe full of Lutolice into the air, because you will go into a full-blown asthma attack. So yeah, we do have a lot of dangerous drugs that we use too. Mycotil can kill you, whether you're a man or a woman. So that's an antibiotic that we use, that if you inject yourself accidentally, can actually kill you. So it's not always just the animals that bite you that can be bad. Brucellosis vaccination, Bang's vaccine is another one that can make you very sick if you inject yourself with it accidentally. So that is something that, again, is kind of on the forefront of veterinary continuing education, is to how to balance work and home life. And unbelievably, what was my statistic? Veterinarians actually have a very high rate of suicide because of the emotional stress. It's a human-animal bond. We bond with our pets, we bond with our patients and our owners. So I'm bonding with twice. You know, I have a pet. I mean, my job is very fulfilling and satisfying because I get to deliver calves. I love delivering calves. That's the best part of my job. And I said I'll practice until I can't deliver calves anymore. And puppies, same thing. That's always the fun. But we also have to know how and when to help make the decision of putting that animal to sleep as well. And so you have to, I mean, I want to be a vet because I love animals. That's great. Can you put that animal to sleep? Because that is a very important part of my practice, is being able to help owners humanely put their pets to sleep. And it's very emotional. You talk about that human-animal bond. That's a very hard part of my job, is to come in and do that. And with my horse clients, you know, I've been with them for 20 years, and I've been the only horse vet at my practice for almost 20 years. Yeah, it's very difficult. Yeah. You have something else?
No, that, you
That
just
added to
said,
that? Yeah. So like I said, it's very rewarding in many parts, but yet, can be a very sad job as well when I can't figure out what is going on with this pet. I have no idea what's going on with your pet. I will tell you this, if you would like to see somebody else who sees more of this type of case, I will refer you to that. So that is one nice thing too, is we have a very good colleague base where we're able to talk to other veterinarians and be able to refer to other people that if I know I can't help you, I will do my darndest to do everything I can. But if I can't, then we need, how far do you want to go with this? Do you love this pet, or do you love a dog? Do you love having a dog, or do you love having this dog? If you love this dog, then this is what you can do. And then we go through and you have to explain what it is I think they have, how much I think it'll cost, because cost for some people will come into play as to whether or not they're going to be able to treatment. If we cannot do this, then let's keep them as comfortable as possible. What can we do to keep them comfortable then? And then we'll go through that scenario as well. And this is where it comes back to the whole communication skills about now being able to sit down and have that honest one-on-one talk with the client about their pet.
I was just gonna ask what animals you have at home, like your.
What do I have at
pets-
home?
Your pets that you have.
I have cats and dogs, obviously. I have 4 house cats. All have different personalities, that's why I love them. I now have 1 dog at home. As you probably have seen on Facebook, is that we had to put one of our pets down this winter. Dogs, cats, cattle, of course. We've had chickens, ducks, geese, occasional sheep. All of my husband's claims we'll never have sheep again, but I love them. I think they're great. I think they're fun. But, and horses. No. Nothing exotics. I don't do too many exotics at home.
Does the veterinarian, like, does the clinic cover like insurance costs, like if you get hurt on the job?
Very good question. So if you are an associate veterinarian, you are covered under workers' compensation. We are required by law to carry workers' compensation for all employees. So even my techs have been bit, have had to go to the hospital, they don't have to pay for that. If they get bit so bad they need stitches, you go. I am the safety officer at our practice, so if you get hurt, you are to report it to me. So that's another, there's safety officer, radiation officer, we control the radiation, so when we take x-rays, we have to keep track of how many x-rays we take, and at what levels we put them, how many retakes we use, and then they come around and inspect that periodically to say, okay, are you over-radionizing your employees? We wear vests, lead, thyroid protectors, and then the larger practice as well. So we're a monitor to see what your level of exposure is, just like a radiology tech would at the hospital. We have little monitors. We're not large enough or use enough so we're not required to use those. But we did recently just get the thyroid protectors because several of us have thyroid issues. I've actually had my thyroid out, so I don't have to wear one. So I don't need that. But we cover the workers' comp, and then for veterinarians, then we have liability insurance as well. And so professional liability. So if anything would happen, if an animal would get hurt, we have an outside facility at our practice that we work animals outside, so if an animal gets out and runs out on the highway and gets hit, then we have insurance to cover stuff like that as well. So yeah, liability insurance is very important for this business as well.
That's really sad. Like,
Yeah.
you're
That'd be
treating
some
an
bad
animal with
I've heard, a fire in your practice, and you've got dogs boarded overnight, or, stay there for surgery, there's been several reports of having fires in practices as well.
We have about 5 minutes of class left, and probably the last minute and a half, 2 minutes, they'll have announcements. So you might want to finish up with your last
questions
question.
on what curiosities of what we do, or good question on the insurance though. That one's very important to know that if you become a vet, you will have coverage for yourself as well.
Any final thoughts for these guys, whether about communication in any career, or if they're thinking about veterinary practice, what maybe should they consider now?
Well, if you're gonna be a veterinarian, any experience you can get with animals prior to and during school is important. I worked, like I said, I started in my junior year of high school working for a dairy farm because I didn't grow up on a dairy farm and I knew I wanted to work with large animals. I got a horse when I was a junior in high school as well because I loved horses and I knew I would want that to be part of what I practiced on as well. Every chance I came home from school, I would ride with the local vet clinic. Say, hey, I'm home this weekend, can I come ride with you? And they're always more than willing to let you go on calls with them and just kind of see different things and see how things work and discuss. One of them was really good because he did talk a little bit about the business side of things as well, which is not something that's usually on your mind when you're trying to get into vet school, is how to buy in or how to be an owner if that's what you want to do, or if you're going to be an associate or if you're going to work for one of the larger clinics and just be a traveling vet. They actually have, some vets don't want to be tied down to the full-time jobs and they're part-time vets, and actually they're kept very busy as well, so they don't work for just one veterinary practice. They'll go around to whoever needs a relief veterinarian and go and work as well. So that's another option as well, as to, if you like a little more diversity and you don't want to have to be tied to one clinic, you can be a relief veterinarian and work in several.
Let's thank Roxanne for her time.
Thank you.